After all the warnings,
Morning, Peter.
all the time, all the deaths, how are there still problems within aged care?
It beggars belief. I mean, it really does beg a belief. And it speaks to the incompetence of the Morrison government. I mean, one of the things that we learnt most clearly last year was that workers moving between different aged care facilities was a source of cross-infection. There was a program put in place to prevent that within private aged care, the responsibility of Scott Morrison. We now learn that program came to an end and that people are now moving between different sites. It is an astounding situation, and Scott Morrison has to take responsibility here. What is completely clear is that when it comes to the management of aged care, this government is incompetent.
The government's response to that rule banning staff from working at several federally run facilities, that it being lifted, was because there was no cases around. So it allowed the movement of staff again between facilities. So is that fair enough in any way?
No, because what it demonstrates again is that this is a Commonwealth government which keeps playing catch-up footy. They follow events rather than leading them. And that's exactly what we're now seeing happen here. It is as if the federal government felt that by the end of last year, they had achieved victory over the virus. And every step that they take, when they say there's no race in getting Australians vaccinated, there's absolutely a race. There is precisely a race, and it's a race against the virus. This is a government which is following events rather than leading them. And what we see in relation to the management of aged care, what we see in relation to the complete failure in respect of vaccinating our population, and what we see in its failure to have proper fit-for-purpose quarantine facilities, is an incompetent federal government which is leaving this country dangerously exposed, and that's now being brought into sharp relief in Victoria.
So if there are no cases, if there are no hotspots around, you believe that staff in federally run aged care facilities should still not be allowed to go and work in multiple facilities?
I think that's the lesson that we learnt last year. And the truth is there are cases all over the world, and there are people coming to Australia. We are still, exposed in that sense to the virus and have been since day one. And the events that are playing out in Victoria, which result from a failure of hotel quarantine, a failure of the federal government, bears out the degree to which we are exposed here. And it's why we need to be vaccinating the population, but it's why we need to be making sure that all the protocols which exist in respect of aged care are maintained in place. I think for all of us who have loved ones in aged care in Victoria, there is a profound sense of anger this morning at where this matter has now got to.
Sure. But,
and it beggars belief.
Sure. But I mean, as you know, wages for those working in aged care are very low. So people need to be able to go and earn extra money if they can. So what is the alternative for them if they can't go and work anywhere else?
Well, the alternative was the incentive scheme that was in place.
But a lot of them believe it was too hard. The paperwork was too hard and it was just too complicated for them to do. So what's the option for them then?
Well, I mean, the incentive scheme in place was the answer. But what's not an option is to allow a situation where people are working in multiple sites, which raises the possibility for cross-infection and raises the possibility of this disease getting back into the aged care facilities. Look, for all of us in Victoria, last year, going through the experience that we went through, easily the most dangerous aspect of it, the most terrifying aspect of it, was what was happening in our aged care facilities. All of us who had loved ones in aged care, who watched day by day the numbers in those facilities grow, wondering what was going to happen to our loved ones, feel the anger today associated with this government removing that incentive and having in place a situation where people are now once again moving between facilities. And it's not good enough to be playing catch-up footy. People's lives are actually at risk here, and this government needs to act.
You've still got an issue with consent, though. There is still a minority, not a majority, but a minority of residents in aged care who are not consenting to the vaccines. So what do you do about that? Well,
again, what you have is a government which actually does this properly. I mean,
but this has got to be on the residents, doesn't it?
No. Well, yeah, but there is nothing like the public campaign in this country that we've seen in either the UK or the US. The federal government does have a role here in building confidence within our community in respect of the vaccine process. Now, all you've got is a government which repeatedly, as late as last weekend, is saying, oh, don't worry, it's not a race. I mean, it's absolutely a race. And you had a health minister who a week or so ago was saying, if you've got a problem, may as well have got up and said, if you've got a problem with AstraZeneca, you can wait till the end of the year. I mean, there have been mixed messages time and again. You look to the UK, you look to the US, there are concerted, purposeful, public campaigns which make it clear that what people need to do is get vaccinated, which is in fact what people do need to do. But the government has a responsibility in making this occur.
More broadly, and speaking now from a business point of view, I mean, you're Victorian, Richard. Your constituents are again in the fourth lockdown in the past 15 or 16 months. Does the state government have to take any blame in this? There's rarely used QR codes. Contact tracing is not up to scratch. How much blame do they have to take in this?
Look, I think last year there were mistakes made, which the state government was upfront with, almost immediately. It had its inquiry about what went wrong. We went through a very difficult few months last year in an extensive lockdown. And I think a lot of experience was gained in relation to that. I don't think there's been any shirking of responsibility from the state government about where it has failed. But might I also say, I think that what the state government did in taking responsibility last year, saw a success in bringing the outbreak under control, which was almost globally unprecedented. So whatever you say about the Victorian government, they have been willing to stand up, take responsibility, act and lead, and that has seen pretty remarkable results in Victoria. What we don't see is anything like the acceptance of responsibility for its work in respect of the Commonwealth Government. There's no admission when it gets things wrong. There's no learnings that we see the government go through. In fact, all you see is buck passing, and what we've now got is profound incompetence. And that is bearing out on businesses in Victoria and what's playing out in Victoria.
Do you want wage subsidies for businesses, extra wage subsidies for businesses?
Well, I think that all needs to be properly looked at, because if we are looking at anything which extends beyond this week, people are doing it tough. And obviously we're in a situation now where, JobKeeper came to an end at the end of March. The Victorian government itself has certainly stumped up with a package. I find it astounding that the Commonwealth is wiping its hands here of responsibility in Victoria and what it can do in an economic sense.